Good afternoon, I'm Dr. Granser, and today I'd like to talk to everyone a little bit about a very important topic to my practice, and that is revision endoscopic sinus surgery. Now, for those of you who don't know what that refers to, basically, it refers to those patients out there who have had previous sinus surgery and are asking themselves, why do I not feel better? And then they go back to the surgeon and he or she is telling them they need to have further sinus surgery. So I'd like to address this specific category of patients because unfortunately it is still a pretty common phenomenon. There are patients who are undergoing procedures with the goal being to reduce the number of flare-ups, and in other situations patients are undergoing sinus surgery to eradicate trapped infection, which has been present for months and in some cases years. And the outcomes from those two scenarios can be quite different. So broadly speaking, there are three general situations that would result in a circumstance where the patient finds themselves no better. And those three main categories are failure as a result of a bacteriologic problem, or in other words, a type of infection you had is something that is difficult to eradicate. The second main category could be failures as a result of your own immune system. And this could be a result of a specific deficit, an antibody defect, for example, that is unable to kill off the bacterium that is causing your sinus infections. And then the third main category of surgical failures consists of structural causes inside your sinuses from previous procedures. So basically, what I think we need to keep in mind is that you need to be seen by a specialist who has enough experience in failed sinus surgery in order to counsel you best. And in some patients, it's a combination of those three factors. Now, clearly there are a number of patients who have had conservative procedures, including various balloon sinuplasties, and it's important to keep in mind that the balloon procedure was intended for very limited structural remodeling inside the sinus cavities, so that procedure has inherent limitations. So I'll throw a caution out to all those patients out there who have had a balloon procedure done. It helped for a while and then their symptoms gradually came back. They went back to their surgeon and he recommended another balloon procedure. Well, chances are those situations require more aggressive or more comprehensive approaches in order to establish a more long-term sustained improvement in your sinuses. And that's fortunately a situation where here at our practice at Breathe America, we can do a comprehensive immune system evaluation. We're able to perform careful endoscopic examinations and to help determine the exact bacteriology of your infection so that we can institute the best medical management for your situation. I think the key to keep in mind if you've had previous sinus surgery and you've been told that you need further sinus surgery is to make sure you get a second opinion. Ideally by a rhinologist or a subspecialist in ENT who deals with sinus diseases, but if not, a general ENT surgeon who's experienced at managing patients who've had previous failed surgery, I think is paramount to ensure a good outcome.